The term refractive errors is very common and very familiar to everybody nowadays, because the people or children suffering from these problems are number is increasing and increasing. So before coming to refractive errors, we have to understand what is refraction in the eye. Everybody knows the basic function of the eye, that is light rays reflected from the objects travels parallel in the air, then it reaches the eye, then it passes through the eye. This is having 4 refractive media, that is external most is cornea, then one liquid medium, that is aqueous humor, then lens, then vitreous humor. Finally it converges, the light rays get converged on the particular point on retina. From there starts the actual steps for getting sense. Different so many types of reactions are there. I am not going to that aspect. So since these 4 media are having refractive power, when the light rays reach there, it is getting deviated or refracted in such a way so that it will converge on that particular point. This is the basic concept. Whenever there is any change or any abnormality in this media, the light rays are not refracted normally, and so it is not getting focused on that point. It may be in front of that. Then it is termed as short-sightedness. Sometimes it may be behind the retina. Then it is known as far-sightedness or long sight. Sometimes it may not be focusing on a particular point, some multifoci or not centralized like that. Then these are known as astigmatism. So the problem of this thing, that is refractive error, is some changes in the refractive media. So only thing we have to do is to normalize these factors and bring back the system to normal. That's all. But if it is on cornea, we have to control, we have to rule out that problem and bring it to normal. If it is in the refractive this media such as vitreous humor, we have to make the consistency or the anatomical condition of that fluid medium to normal. If it is the lens, we have to bring it the normal structure. But we have to understand first, all these are living cells in our body, not a mechanical piece of, like that, or a glass piece. Or like whenever we say lens, there will be a consent ornament is a glass piece like a lens. It is not like that. These are living cells having its own metabolic activities and catabolic activities and life. So any medicine will act on it, like just like our blood or the skin or the flesh, like that. This also is a cell, living cell, and any medicine will act on that. Why such a doubt? That I don't know. People are having such a doubt. Maybe because that picture in their minds, which they have studied in their school classes, that is just like a comparing camera and eye, the function. That is just for understanding purpose only. But we can make changes in that. If we have to make the curvature of the lens to make it more curvature, we have to compress the cells so that it will become, these are all made up of these protein fibers only. Any medicine will act on the protein fibers and the muscle function. It is becoming contracted or expanded by the suspension ligaments. These ligaments can be stretched or expanded or contracted by medicines, just like our muscle of our body. If there is a spasm of our body and of calf muscle or hand, biceps muscle, etc., we are doing treatment and making it relaxed or contracted or stretched like that. That type of treatment is possible in the eye muscles and eye fibers of the lens or the cells of the cornea. There also the same action is possible, but the medicine should be highly selective, which will act on that. There is a term that is site of action. That means all medicine will not act in all structures. So, for example, I will say, we know the cardiac muscle and calf muscles. Both are known as muscles, but the function is different. So, the same medicine cannot be used for the problem of a cardiac muscle and the problem of a calf muscle, even though the muscle is, the term is common. Like that, there is muscles in the eye also. There is rectus muscles and this iris muscles, and there also it is, the term is muscle, but the function is different, sensitivity different. So, the medicine also will be different. To select that medicine which is capable of acting on that particular structure, particular muscle, that is the expertise of the patient, and that should be on the basis of theory also. In Ayurveda, there is a particular term, that chakshusya, that means which is capable of acting on the eye, the ophthalmic system, ophthalmic tissues. So, it is our duty, it is our expertise to select that type of medicines for the treatment of eye disease. So, if we have to do some treatment on the muscles of the eye, we have to select some chakshusya drugs which will work on the muscles. So, we will get maximum result on that particular muscle only. It will not be giving that result on the calf muscle. If since it is working on the muscle, we can use it there. So, that is the difference in Ayurvedic approach. We can select particular group of medicine. There are so many group of medicines like that which will work on skin, that is Rakta Prasadagaram, or that means that it will be working on the blood tissues. And there is some Chakshusha that is working on the eye, or Keshyam that will be working on the hair only, and Tok Prasadagaram, that means it will be working on the skin on mainly. To select that type of medicine, drugs, and having the particular action on with the vitiated factor, Vata, Pitta, Kapha, etc. So, we have to implement the theory to that. If you are doing a Vata predominant eye disease, we have to select a drug which is having Vata Shamana, that means it will control the vitiation of Vata, and also which will act in the maximum level in the eye also. That combination only will give the results. In that way, we can manage any disease in the eye. It is not a problem.